We're 6 feet apart, so I can take my mask off this morning, but students and parents and families, welcome. This is our Facebook Live session in regard to our Racer Restart plan for this fall, and we're going to discuss a number of Racer healthy guidelines that we'll be putting in place this fall. But before we do that and be thinking about your questions over the next several minutes, I'd like to introduce our other guests that are with us today. Dr. Don Robertson, our Vice President of Student Affairs and Enrollment Management, and Dr. Bob Hughes, the Chief Medical Officer for Murray State University Health Services and Primary Care Medical Center. So over the last 6 months or so, we've been dealing with a lot of different issues on our campus here at Murray State University, as well as all colleges and universities in our country. For the last few months, we've been putting together a Racer Restart plan, and about 200 faculty, staff, students, healthcare professionals, and others have been working on this plan. It went live about 3 or 4 weeks ago. And if you go to our website today at murraystate.edu/Racer Restart, you can access the plan and videos, which we're going to show you in just a moment, a lot of Q&A, and other information that will be helpful to you as we prepare for fall. So let's stop there for a second, and we have a couple of videos that I think you'll enjoy first, and then secondly, it may prompt some questions from each of you for later in just a few minutes.
Murray State University is committed to the health, safety, and well-being of our students, faculty, staff, and the broader community. Please be sure to follow our 12 important Racer Safe and Healthy guidelines. Regularly wash your hands for at least 20 seconds and use hand sanitizer frequently. Check your temperature daily. If you feel sick, stay home. Wear a face mask. Utilize Murray State Health Services. Call, visit, or televisit. Practice social distancing. Keep your workstation or room sanitized. Get a flu shot. Exhibit healthy behavior. Download the Apple COVID-19 app for daily use. Eat well, exercise, get plenty of rest. Finally, make good choices. Be sure to visit murraystate.edu/Racer Restart for important Racer Safe and Healthy updates, resources, and tips. Through the Racer Safe and Healthy initiative, we pledge to do our part for each of us, our Racer family, and our community. We are forward moving. We are family. We are Racers.
As part of the Racer Restart initiative, it is essential that we follow best practices when it comes to the health, safety, and well-being of our campus and our community. We must do our part during this pandemic. One of the most important things you can do to protect yourself and others is to wear a mask or face covering. Just like you'd put on your seatbelt when you get behind the wheel, or drive slowly through a school zone, or simply being a responsible citizen, we all have a responsibility to help slow the spread of COVID-19. Wearing a mask is the single most important thing we can do to slow the spread of this disease. It is cheap and easy. We're providing every student, faculty, and staff member with masks. According to various health professionals, 80% of COVID-19 cases are asymptomatic, meaning no symptoms. Even if you feel fine, there's a chance you could be carrying this virus and risk spreading it to others. So wear a mask. Make sure you wear your mask anytime you're around other people in public, whether you're picking up groceries, pumping gas, or at work, or on campus this fall. The CDC says wearing a mask or face covering, along with social distancing and frequent hand washing, are the simplest and most effective ways you can do your part. Visit murraystate.edu/Racer Restart for other important Racer Safe and Healthy updates, resources, and tips. Be smart and be safe. Let's make good choices and do your part for our Racer family and our community. We look forward to seeing you this fall. So these are some of the major changes we've made on campus during the last few months. And I know there will be a lot of questions today, and if we don't get to your question, it will be answered through Facebook. So just be prepared for that. And lastly, I would stop there for just a moment. Lastly, I want to defer to Dr. Robertson and Dr. Hughes for a few words, and then we'll see what questions you may have today. Thank you again for joining us.
Okay, well, I too want to say, first of all, I'll let you know how how excited we are and how much we're looking forward to our students returning to campus this August. As you know, the move-in process will start on August 10th. We're busily preparing for that, and of course our number one objective is to make sure everything is safe, everything is healthy for our students so that we can have a very good semester. So lots of people have been involved, lots of people in the planning process, in getting ready for the campus to open and to try to, our goal is to have as near a normal fall that we can have. Obviously there will be some changes, some adjustments, but the main message is we've missed you, students. We've missed you. We've missed having you on campus, and we want to do everything we can to get you back on campus and make sure that you have a very positive experience this fall.
I'm Bob Hughes. I'm the Chief Medical Officer here, and I've been in Murray 36 years, and this is my home now. This is a crown jewel for this community, and I just can't say enough good things about the university. And we look forward to having you back. And there has been no amount of effort that's been spared since we've been working on this pandemic and getting the university ready. And there's no amount of resources that will be spared in taking care of your children, your loved ones. And I just want to assure the parents of that it's a serious problem nationally, but there's been no effort spared here at Murray State to make this as safe as possible for your children.
Dr. Hughes, thank you. Thanks for all that you've done and your staff have done over the last many weeks. We appreciate it. Dr. Robertson, thank you. And a question that I received this morning, and I'll start here. So it was a question I received as I was walking across campus. What is the academic calendar for this fall? And again, if you go to murraystate.edu, Race or Restart, you'll see the academic calendar as well as a lot of other information that I think will answer many questions that students that you have, families, parents that you'll have as well. Move-in will start about a week before classes start. So you'll be able to schedule a day and a time in regard to moving in. You'll just need to call the housing office. If you go to the website, you can just put in housing office, find the number, and call, and they'll schedule that time and day for you to move in. The classes start on August 17th, so that's the first day of classes. That's changed slightly from the decision made about 6 months ago, so it's one day earlier. The semester will end on November the 20th. And if we're able to, if state and federal guidelines allow it, there will be a commencement on November 21st, which is a Saturday. So the semester will go from August 17th through November the 20th. And again, we will have a mixture of in-person classes, hybrid classes, and there will be some online classes, but you will know that through your class schedule that is available on your MyGate account as well. So some of these things may help you. There was a question I just literally received a few minutes ago. Any other questions? And I'm sure we'll have several.
Yes, we've had a few questions come through. The first one being, can you all discuss a little bit about what safety measures have been taken to sanitize, prepare different areas of campus such as dining facilities, dorm rooms, those central areas where students might be visiting?
Sure. Well, let me say this, and then I'll flip it to Dr. Robertson in regard to that question. So our cleaning contractor, our custodial contractor that we work with very closely, will be deep cleaning all of the residential halls. They'll be cleaning them regularly during the semester. That's an area obviously that we're extremely focused on. So we're handling all of that I think extremely well, and we'll continue to as we move in to the semester. Also, you'll be able to request, and we have surveyed all of the residents on campus, would you like a private room or not? And so we've received responses back from many students. They would like to have a private room. We're accommodating that. Many want to keep their room assignment the way it is, so we're accommodating that as well. But we're making sure that we're reviewing the residential halls very specifically from a health and safety standpoint.
Yes, and actually every office on campus has developed what we call a race or restart plan in preparing their office, making sure things, everything from the cleaning, from how we're going to deliver services, making sure we have social distancing. We want to make sure we can provide our services in a safe and efficient and effective manner. But everything you could think of in terms of starting the semester and how your particular office and unit is going to operate are in these restart plans. And again, the primary focus has been safety, the safety of our students, or safety of our faculty and staff, at the same time being able to deliver the services that our students are going to need. So a lot of cleaning, a lot of hand sanitizing, the wearing of your mask, lots of plexiglass is being put up. Again, all the precautions, as Dr. Hughes mentioned earlier in his opening comments, we're not sparing any expense, and we're always thinking of what else can we do, what else do we need to do. So it's a continuing developing plan, but we're ready, and we'll be ready in August once our students start returning.
Absolutely. And related not just to residential halls, but all the buildings on this campus. Our facilities management team has done a fantastic job. They've gone around and looked at every classroom, every space, how many people can fit into this space safely using social distancing and using the occupancy requirements that we have today. So if a former classroom would hold 30 students, maybe today it holds 12 or 15. And we're doing that all over campus, and we have been for many weeks now, adjusting the size down. We're putting up plexiglass where we need to put up plexiglass. There will be hand sanitizing stations located all over campus as an example. But just about everything that one can think of, we've tried to accommodate that, and there have been, believe me, many questions over the last many months, and I think we've answered them well, and as Dr. Robertson said, we're ready, and we're looking forward to the fall, which is fastly approaching.
Yeah, everything from directional signs to, in terms of a programming standpoint, we're adjusting what we typically would do in programming to meet the capacity requirements of facilities. Most of our activities, we do things, we know it'll be safer to do those outside, so we're planning for more outside activities and events, but we're certainly going to be aware of the capacity, the social distancing, and again, we're working hard on that, and we've gotten a lot of student input on how to proceed, and that's been very, very helpful to us.
Another item that's very important, Murray State University Health Services, which is located on the first level of Wells Hall, and it's used regularly, and our students know where Health Services is located, and they're very active. And that Health Services is managed by Primary Care Medical Center, Dr. Bob Hughes and his staff, and so the hours are well known. You can go to the website and see that as well. We're going to be doing flu shot sessions earlier and more often than we have in the past, as an example, and just making sure that Health Services is responding in this global pandemic the way it needs to, in taking care of our campus community, our faculty and our staff and our students on a regular and as needed basis. And Dr. Hughes may want to speak to the staffing or speak some of the things going on there, which is vitally important, I know, to families and parents and students.
Yeah, I think it's very important. I've got 4 children of my own, and I sort of hesitate to use the word children. They're actually adults now, but they're adults or students or scholars, and it's very important when your son or daughter goes away, and you may be hundreds of miles away, to know how well they're taken care of, and the fact that you can find out with their permission. Of course, they're adults now, and we have to be very conscientious of the privacy laws, but at any point in time a parent wants to talk to me about their student, they can get a hold of me, and with the student's permission, I'll share that with them, because you're always just one step away from getting in the car. Do I drive to Murray? Do I stay? How sick are they really? So I think one of the big things is communication, with or without the pandemic. And speaking to the pandemic, we've been closely working on this for months. I mean, I guess we started in January or February, back before it became such a big issue, but we're very conscientious of that. The hours at the Student Health Center will be adjusted based upon need, and if it's outside of those hours, the office that we have is large and it backs that up, so it's 24/7. It's open 7 days a week. It's not open 24/7, but it's open 8 to 8, Monday through Friday, 8 to 6, Saturday and Sunday. So that backs up Student Health. So if they call Student Health and that office happens to be closed, which again, we're going to run the maximal number of hours necessary to cover the need, but in case that need is past those hours, primary care will be there, and all the records are in the same place, the same computer system. And then there's also a portal access that the student sets up an account so that all of their information's on that. Now that's their medical protected information, but if they so choose to share their username, password with their parents, you know, they can access that as well. So there's a lot of communication that is available. I think it's very important for the parents to obviously have someone that will talk to them that's medical, and it'll be primarily myself and Misty Sanderson, a nurse practitioner that works closely with me, and it'll be staffed appropriately.
You might touch on telemedicine today and telehealth and what you're doing there with students and families and parents and faculty and staff as well.
Yeah. Well, the option is available to the students, and there are a lot of times a lot of more tech savvy than maybe people of our generation, but the point being is that if they want to do a telemedicine visit, that's available, and then during that telemedicine visit, if it requires a physical presence, that they actually be seen, because there are certain conditions, for instance, a potential appendicitis that you just cannot manage that way, that we'll bring them in to the office where we have CT scanning and all the diagnostic modalities and take care of them that way. So they can go telemedicine first, they can go a telephone call, they can do an in-person visit, so there's all those options available. And then if in the midst of that telemedicine visit at any point in time it's determined they need to be seen, then we'll bring them in. They'll be prioritized, they won't have to wait, and we have a system in place that if they come from Murray State over to the main office, then they're rushed right in without having to wait. And then at the same time too, if they give us permission to talk to the parents, then we'll do that as well.
And let's hope no one needs Murray State University Health Services this fall, but if you do, we have a wonderful system set up and a wonderful health services operation that will be able to help you.
Let me add just one thing to that, because and Dr. Hughes may want to comment on this also. We do have a testing procedure in place if we need to test someone, and we also have a quarantine process in place if we had to quarantine a student that is living on campus. We certainly hope that won't be the case, but again, we have a process, we have a plan, and it's just we have a plan virtually for everything you can think of that could potentially come up. And as we're working, right now our resident directors and RAs will soon be returning to campus for our residence halls. We have a lot of staff training, so these individuals will know what to do if in case there was some kind of medical need on campus.
And in regard to the plan, again, it looks like this. And there's a PDF of this document on the website, and it will answer probably 99% of every question, of questions that you may have. And take time, print it off, look at it, and if you have other questions after this Facebook Live session, please email us and we'll answer those. It's updated regularly, and again, you'll be able to find it at the website. It's a PDF and it's been worked on for months, and I noticed it was just updated a day or two ago, and I think there's an update being made to it today as we get additional guidance from the state and federal government.
How can students make sure that their safety measures are occurring in campus? What things are regularly going to be happening with students, faculty, and staff for that matter, that should be occurring daily, weekly, as they return to campus? Temperature checks, those types of situations.
Right, there's a very good question, and I think once students move in and you see campus and all the changes to campus, you'll notice them very quickly. You'll notice different spacing protocols, social distancing, as we call it. You'll notice masks, which are required on our campus for students and faculty and staff. So you'll notice all those things. Those are very visible things. You'll see plexiglass in areas where there's face-to-face activity. You'll see plexiglass. We probably have purchased a couple of miles of plexiglass in the last many months, and we're installing it regularly, probably even including today. So you'll see things like that. You'll go into classrooms and you'll see a whole lot less seats, or some seats marked off and the spacing maybe cut down by 50%. You'll see, as we move into residential halls, a very slow, methodical, safe process of moving in. And for current students who were here when we had to move out in March, it was a very careful and safe and methodical process of moving off of campus. So you probably saw that too. So those are some of the visible things you'll see. We've had to change literally every aspect of campus and campus life. And that's for the health and safety of our faculty and staff and students. All of us too. We're here every day. We want to make sure that this is the best environment that it possibly can be for everyone here. And it will be. That doesn't mean we won't have an issue or problem, but it means that we're taking every precaution possible, and you'll see that very visibly as you move forward. Several people have commented already over the last many weeks about our Racer Restart plan. A lot of detail and thought went into it, and I think a lot of work went into it by nearly a couple hundred people, as I said earlier. So I think you'll notice that as well as you read through it.
You will also, and particularly the students, they're going to see a very comprehensive education program rolled out, a lot of marketing, a lot of reminders of the protocols, lots of emphasis on the safety guidelines. There will be an online informational program that each of our students are going to be required to take that will provide, again, information about how to stay safe and what our expectations are, and they'll access that through their MyGate account. That'll be coming soon. In things even in the classroom, each of the faculty are going to have in their syllabus the reminders of the safety guidelines, the expectations, what students need to be doing. And then also, we're in the process of identifying and hiring what we're going to call some wellness ambassadors, and these are going to be student leaders that are going to be out at events and activities, again, and their job is, again, to remind people to make sure they're following the safety guidelines, and we're keeping everything as safe as possible. So again, a lot of it's going to be communication, education, both to the students, but also to parents, the communication to you also, so that you know what's going on through our parents newsletter and other mechanisms like that.
Yeah. We'll get through this, and this will pass. And a vaccine is coming, and no one knows when that is. But in the meantime, all of the precautions that we're taking, the health and safety guidelines that we're putting forward will help us get to that point. And we will get there. And Murray State is committed to making sure we get to the other side of this as safely as we possibly can. And we think we're ready for that. And I know Dr. Hughes had a comment as well.
I want to make a comment. You know, the situation is fluid. The three of us and many others are in constant contact because one thing about this is that the guidelines or what comes down is changing on a daily basis. And one of the things I can assure the parents and the students is we're on top of that. I mean, and the practices we put in place here will be the best practices consistent with any university anywhere to ensure the safety of the students. And to do that, things may change. You know, we may end up putting in different things that are there today, may be different tomorrow. But again, it'll be based on what is the best practice at that time, based upon a changing environment as more knowledge becomes available. And I think, as Dr. Jackson mentioned with regards to a vaccine, I do think there'll be a vaccine. When that'll be available, I don't know. But we would like to think, and we're pretty sure we'll be the first to have everything out there for the students, because that's very important, very important.
Absolutely.
As far as traveling to and from campus, are there any restrictions for students should they want to travel home on the weekends or somewhere else?
There are no restrictions today in regard to traveling to and away from campus. Now, for international students, as an example, and I'll use that as an example, or maybe others that have traveled overseas, if anyone has done that, it's probably a very, very small number. there's some issues there that we have to work through. But in regard to this country and traveling state to state, no, or within the state, no. There are no issues, no travel restrictions, those type things. So, you know, if there are specific questions about, hey, I traveled abroad and I'm coming back now, you know, please direct that to us and we'll answer that very specifically. But within states and within this state, there are no issues.
Yeah. And I'd like to make a comment on that too. One of the things about travel, if there's any travel restrictions, it would be a government imposed thing or a state imposed thing. It would not be necessarily a university imposed thing. But I would ask that people be smart, you know, be safe, think about where you go, look ahead to see where you're going, and don't put yourself at risk. And then also too, with regards to your circles, you know, try to keep them a little bit tight, a little bit small. You know, don't put yourself at risk if you don't have to. So, but again, if there's any guidance, you know, they can call Student Health and we'll give you the most up-to-date recommendations. But again, you know, just be smart, be safe.
And to that point, Dr. Bob Hughes is exactly right. When you do travel, if you travel off campus, and the reason we change the academic calendars to try to keep our students on campus as much as possible for as long as possible, and we're stopping early pre-Thanksgiving, so we're squeezing in the semester very differently. But if you do travel and if you do go home, still adhere to the protocols that we're preaching, that we're telling you about. Wear a mask. We've said that a number of times. Wear a mask. Use social distancing. Use good judgment because we don't want to see students come back that may have an illness.
In that same vein of traveling, could you speak a little bit about our international students and how we're accommodating them for coming back on campus potentially?
Sure. Dr. Robertson?
Yes, and of course our international students are very important to us, and so we've been in contact with international students. We're sending out information. We have those, if our new international students or any student that's returning, we're going to have shuttles available to pick them up at the airport. We have a testing procedure once they arrive on campus just to make sure everything is safe for them. So we want to make sure we're meeting the needs of our international students, both their academic needs as well as their physical needs. And so we're going to place special attention to make sure that we are helping our international students once they return to this country to have a safe settling in process. Of course, many of our international students stayed here over the summer, and probably 90% of our international students, they'll be returning from, many of them stayed in Murray or they may be in other locations, so they'll be like just any other student returning.
And many of them are on campus.
And many are on campus.
Still.
On campus still.
Right.
So, but any of our new students, those are the ones that we will, we have a testing procedure in place, and again, just to make sure that when they get here, they're going to be safe and we're taking care of their needs.
Can we speak to the housing process? I know we touched on this earlier, but just for some clarification, students will be receiving an email with their housing assignments, correct? And then they will be able to sign up for their move-in dates later this month.
Yeah, let me start on that. The students should have already received their housing assignment. That should have gone out to them.
This week, guys.
This week, and if you did not receive that, you look on your MyGate account. If you did not, you can call the housing office, as Dr. Jackson indicated. And then they're going to soon be receiving an email that will allow them, it will give them instructions on how to go online, and there's going to be a schedule of move-in times, and they can pick the time Monday through Friday, or Monday through Saturday actually, starting on the 10th, that'll best meet their need. But we're going to limit the number that can come in so that once a time slot is full, then that slot would be closed out. But you're looking at starting at 8 in the morning to 6 at night, a limited number coming in to keep it as structured and as safe as possible. So they should already have their housing assignment, and then they'll shortly be receiving the email where they can go online and sign up for a move-in time that best meets their schedule.
Dr. Hughes, this might be a question appropriate for you. If there is some type of incident on campus or case on campus regarding a COVID case, will campus be notified? How will students or faculty and staff be notified about that? Or will they?
Well, first and foremost, the answer to that is yes. But within that answer, there's certain privacy guidelines we have to follow. So, for instance, if student health diagnoses a student with COVID-19 or a positive coronavirus test, then we'll promptly notify that student of the results of that. And currently it's 18 to 36 hours. We're working diligently to try to get a rapid test, but you know, the country's needs right now and the need for that rapid test in areas that are proverbial hotspots is making that a little bit difficult. But as soon as we can get a rapid test, we'll put that in place. But right now the turnaround is 18 to 36 hours. As soon as we get that, we'll notify the student, and then in turn we'll notify the health department, which is the protocol. And then the health department will begin to do contact tracing, which will be all the people that student may have come in contact with. Now, the group here and a larger group have been working on various protocols too to notify the faculty member that they may have been in the class with, who in turn would notify the class. Again, being conscientious to the privacy concerns, but first and foremost, and in addition to that, the safety concerns for all those. So yes, we've, I would say just in the last 2 days have had at least 3 meetings on that very question on how do you handle a positive test result in a way that that takes care of the student that's positive, which that part's the easier part, and then notifying all the other potential people that could have come in contact. But again, the practice on that will be consistent with the guidelines that have been set down by the CDC, but also too will be first and foremost focusing on the safety of that student, all the students they may have come in contact with, as well as the faculty and staff members.
You mentioned earlier as well about medical records and the security of those. Can you speak a little bit about the COVID-19 app that we're recommending students have, and potentially how they should use that, and obviously the security of that as well?
There's a lot of COVID-19 apps out there, and the one and please correct me if I get anything sideways, but the one that we chose was the one developed by Apple. And it's really for the use of the student to daily self-test themselves to see if they potentially have COVID, and instruct them what do they need to do. For instance, if they have a fever, do they have a cough, do they have a reason to be tested? And at the end of that, developed by Apple, which is obviously a very reputable company, gives them a recommendation. And we just ask that they take that, and a lot of this boils down to an honor system for them to do that every day. But then again, there's a protocol in place. What happens if that says you need a test? Then they'll know based on materials we put out and education we put out, where do they go from there, which most likely will be student health. And then at that point in time, we'll test them, and then we have a quarantine process in place till they get the test result back.
The reason, if I could add, we chose this particular app for smartphones as well, any smartphone, Apple phone or an Android, is because it was created and built in partnership with the CDC. So Apple and CDC created this app, and it's the one recommended to us to use.
Perfect. Can you speak a little bit about what dining services will look like? I know we mentioned earlier about the spacing of tables and things like that, but what services will be available? Will they be to-go options? What's going to be available to students?
Everything will be open. Obviously, social distancing will be used. There will be less seating in some places, and Chick-fil-A is one, I'll use it as an example, will be no seating, it's carry-out only. So what we're doing is we're going around campus and finding spots where we can put more tables outside. We're putting more tables, for example, Dr. Robertson, in the Curris Center. Yes. We're putting more tables in different places for carry-out purposes, so students can use, faculty, staff, and students can use dining services as they carry out. There will be in dining. It'll just be spaced differently, and it will look differently than it has in the past.
Well, let's remind everyone again of the expectations of when they're coming to campus, the survey that they should be receiving, the measures that they need to be taking prior to coming to campus, and those move-in dates toward the middle of August.
So make sure that you look at your MyGate account regularly, both for email updates from the university. Sometimes you'll get them from me, sometimes Dr. Robertson, sometimes from others. But also there's a return to campus questionnaire, health questionnaire. So before you come back to Murray State, if you're a new student, before you arrive, you need to fill that out. And that will tell us a lot of information about you, so we can watch for that and help you as you get here. Make sure in regard to move-in dates, request your day and time to move in. That's coming soon, starting I think on August 10th. It's about a week before classes start. So make sure you look at that as well. And I want to assure everyone again that we've been working on this for months. We've been working on this really since March, since we moved students off campus, is preparing to return back to normal as we can be in this new normal environment. And so watch regularly for updates, read the Racer Restart Plan. It's changed regularly, and there's a lot of information that we're sending your way nearly daily. So please watch for all of that.
Yeah, and I would just remind everyone, as is typical of Murray State University, and this is what we're known for, there's a lot of people on campus to assist, to help you, to answer your questions. There's no inappropriate question. Certainly we want you to call, we want you to email us. We want to make sure we're providing you as much information as we can before you arrive back on campus or before you come to start your first day of classes. And so you're going to receive some additional information before the semester begins. But anytime you have a question, you can always call the Office of Student Affairs. There's a number of offices you can call on campus. Let us help you prepare for your return to campus. But you're going to find, as you've always found, and this is what, like I said, what we're known for, is just that there's a lot of folks here ready to assist. And as always, we want this to be the most positive experience it can be for you as we start this fall semester.
I'll close with this. Look at the website. That's extremely important. The 12 Racer Safe and Healthy guidelines. Make sure that you know those, adhere to those, and most importantly, now and when you get here, wear a mask. And so we're going to put our mask back on. If you have additional questions, just email us, call us, and we'll answer everything that has been submitted to us today. And thank you all very much.
Thank you very much.
Murray State University is committed to the health, safety, and well-being of our students, faculty, staff, and the broader community. Please be sure to follow our 12 important Racer Safe and Healthy guidelines. Regularly wash your hands for at least 20 seconds and use hand sanitizer frequently. Check your temperature daily. If you feel sick, stay home. Wear a face mask. Utilize Murray State Health Services. Call, visit, or televisit. Practice social distancing. Keep your workstation or room sanitized. Get a flu shot. Exhibit healthy behavior. Download the Apple COVID-19 app for daily use. Eat well, exercise, get plenty of rest. Finally, make good choices. Be sure to visit murraystate.edu/racerrestart for important Racer Safe and Healthy updates, resources, and tips. Through the Racer Safe and Healthy initiative, we pledge to do our part for each of us, our Racer family, and our community. We are forward moving. We are family. We are Racers.